Debate, and here this debate would be on a small pupil. What would be the pupillary expander of choice? The BHEX versus the iris retractors. आगे नहीं जा रहे? थोड़ा चेक करिए. Yeah, okay. So the BHEX is basically innovation of our very own Dr. Suven Bhattacharya ji. Just to tell you all about what it is, it's a very thin profiled, very gentle expander, okay, around 0.075 millimeters. It's gentle yet firm. So what do we want? We want to keep the pupil at bay. We don't want the pupil to come down on you when you're operating. So what does it have? It has 6 notches which engage the pupil and 6 flanges. 3 of them go above the iris and 3 of them go below the iris. So now let's see how it works. So this is a patient. So here you can use a 23 gauge microforceps which you are putting in through the main port. You can also put in through the side port, and the 2 side flanges you are using either a Sinskey hook or the 23 gauge forceps and using the side port. So look at how good the adequate kind of opening that you are getting. So all your procedures you can continue extremely easily as if there has been just a well dilated pupil. Each and every step of the phacoemulsification can be carried out extremely easily, and look at how easily you can remove it. So you just have to hold on to it, disentangle it from the, disengage it from the pupillary edge, and then you can remove it even through the side port. And this is a first day post-op, 6/6, and you can see that the pupil has not even, you feel it's not even been touched. Now this was a floppy iris, and the BHEX also works very well here. Now we all know in a floppy iris there is going to be a lot of floppiness, a recurrent iris prolapse. As you can see, even a mild hydrodissection, the iris tends to keep prolapsing. In these cases, yes, iris retractors can be used, but what is more important is you should not touch or you should not irritate the iris more. So here you're gently disengaging it from the pupillary edge and then removing it. And this is 6 hours post-op. Patient is doing extremely well. Now in iris hooks, what are the downside? Multiple incisions. Already you have 2 side ports, already you have 1 main port, and you make 4 more ports, which is no need at all. It's more time consuming. Who has the time to make 1, 2, 3, 4, 5, 6, 7 incisions and then remove them at the end of it? And this is what finally you get, because many times you tend to pull so much that you can cause sphincter tears, and this can be how it looks like. Yes, where to insert, that's a very, very important decision. You insert it too high and the iris will be pulled up towards the cornea. You insert it too low and it will be all bunched up towards the edge, and the phaco, when you are putting it, it will keep scraping against the iris, which irritates it more. So you need to get that sweet spot as to where exactly to make those incisions for the iris hooks. How much to pull is very important. You pull too less and you have a small opening. You pull too more and you damage the sphincter. All these problems are negated in case of the BHEX. Now in a difficult situation, so this was a patient where I thought it's a mid-dilated pupil, I can go ahead without any pupillary expander, and look at what happens. Even before the hydrodissection is done, the pupil is coming down, as if I've put pilocarpine. I tried to put in epitrate, I tried to put in phenocaine plus, but nothing worked. Now, if we had used an iris retractor in this scenario, definitely I would have also pulled on to the capsular rim, but here the BHEX works very well because it's so gentle and you can do it under good visibility and very, very easily. Definitely there could be a small learning curve, but it works so well. Look at the ease with which the BHEX can be removed, and look at the pupillary edge. It's absolutely pristine. Even in cases like this, in a very small pupil, yes, if it's a very difficult case, people have used Melugan rings also, but why not our own simple BHEX? Yes, if it's a very small pupil, you may need to do a little pupillary stretching here before you go in for the BHEX, but yes, it works extremely well. This was another case where a femto was done and then the pupil came down. Yes, in flax, sometimes there is a prostaglandin release and the pupil may come down, but there's no issue at all. We can go ahead with the BHEX in these cases also. So the capsulotomy was not even touched. Now we are removing the capsular flap. going ahead with the hydrodissection, and this was a multifocal lens. So we thought that the pupil, the capsulotomy size was a slightly lesser, so we have now extended it, and now we are removing the BHEX. So look at the pupillary edge, it's absolutely pristine. So even if you compare it with the Malugan ring, you get a good 5.5 millimeter opening, which is absolutely enough for all your phaco maneuvers. It's an extremely thin profile, uniplanar, which is its biggest advantage, and it's jointless and extremely economical in today's scenario for all of us who would want a Malugan ring and charge so much from the patient. Yes, so to conclude, in today's world of increased expectations and use of premium lenses, we definitely can use such devices and then give good visual outcomes to our patients. So the BHEX expander is truly the Lord of the Rings, and it will make small beautiful. Thank you so much.